My name is Derek Cataldo. I grew up in Massachusetts. I moved to Manchester about 15 years ago, and I've been living here ever since. I work at the Manchester Police Department, and I've also been on the board of directors for the center for about 3 years. We became partners on some training, called it crisis intervention training. So it's training that focused on giving officers kind of skills to deal with folks who are in crisis, specifically mental health issues. And I took that training. I loved it. I thought it was excellent. I was extremely impressed with the trainers, the subject material, the way it was presented, and the relevance to our department. And that was really my first exposure to the center. Before I really knew much about the center, my assumptions were it was more clinical in nature, where people would make an appointment, you show up to an office, you'd be in a waiting room, and you'd see somebody. That's certainly part of it, but the amount of time that the employees from the center spend on the street in rapid response, I think would surprise a lot of people. Rapid response is a 24-hour mobile crisis response unit in the city that's manned by members of the center, and then our officers respond with them. They're out there constantly. They're in situations which can be dangerous. They're in situations which can be intense. These are folks that don't have, professional law enforcement training. They don't have any tools to protect themselves. They're there for those people in crisis, and they're eager to get in there. Oftentimes we would have to hold them back. Like, hey, let us go in, let us make sure this is safe, and then you can come in and do your work. And they were right there. Just thinking of one specific one, somebody in crisis who called, they were thought to be possibly armed. We weren't exactly sure where they were. They were kind of walking around, calling intermittently. I remember going out in the car and not sure that I should take the mobile crisis folks with me, and like, this may not be, and they just insisted on it. They wanted to be there as soon as possible so they could be with them, and that's what struck me the most, and that's, I think, gave me an enormous amount of respect for the folks that do that work, and that partnership that they have with us. I think, it remains to this day because of that mutual respect and the value we get from that. We make an effort to get almost all our officers through crisis intervention training, and we have a pin every officer who's certified in CIT wears in their uniform. It seems like a small thing, but to have something like that designated by a department, that if an officer goes through this, you're going to wear it on your shirt, and it's going to be recognized, and it's going to be something you're going to look at every single day. That's meaningful, and I think that speaks to the value and the quality of the training and the importance to the department and the officers. And it's hard to quantify what would have happened if we didn't have it or things like that, but times I drew on things I learned in that training to deal with folks who were in crisis, with and without mobile crisis folks with me. If I didn't have that, and if our officers didn't have that, oftentimes some of those interactions may go a different way. Most people think of community calling the police for help, and that is true. That's our function in the community. But another way to think of what we do with the center is when we're in a situation with someone in crisis and we need help, we call the Mental Health Center of Greater Manchester. We call rapid response.